If you're over 60, over 70, or helping an older parent manage blood pressure, you've probably heard completely different answers. One person says 120 over 80 is the gold standard no matter what. Another says that number is too low for seniors. Someone else says higher numbers are normal with age, so don't worry about it. And if you're confused, I understand why. Nearly half of adults have high blood pressure, and the risk rises as we get older, so this is not a small issue. It affects millions of families, and the wrong message can create unnecessary fear or false confidence. I'm Dr. Alina Serratia, and in this video, I want to give you a science-backed understanding of what the best blood pressure really is for older adults. Not a magic bullet, not a viral shortcut, and not a fear-based answer designed to shock you. The exact truth is actually more useful than that. The best blood pressure for an older adult is not about chasing the lowest possible number. It is about finding the safest number that protects the brain, heart, kidneys, and blood vessels without causing weakness, dizziness, falls, or poor quality of life. And before we go further, I want to say something clearly because your health matters more than any video. This content is for education only. It is not personal medical advice, and it should never replace your own doctor's judgment. Please do not stop, start, or change blood pressure medication, supplements, salt intake, or exercise routines based only on this video. If you have high readings, low readings, kidney disease, chest pain, fainting, or medication side effects, talk with your clinician before changing your regimen. Now let's talk about why this topic gets so confusing. Blood pressure is the force of blood pushing against the walls of your arteries. The top number, the systolic pressure, is the pressure when the heart pumps. The bottom number, the diastolic pressure, is the pressure when the heart relaxes between beats. As we age, the large arteries often become stiffer. Think of your arteries like a garden hose. When the hose is new, it is flexible, soft, and it absorbs pressure smoothly. But when that hose gets older and stiffer, the pressure wave hits harder. That is one reason many older adults develop a higher top number, even when the bottom number stays normal or low. This pattern is so common that it has a name: isolated systolic hypertension. That means the top number is elevated while the bottom number is not. And this matters because many older adults look only at the bottom number and think, well, my diastolic isn't that bad, so maybe I'm okay. But the top number still counts. In fact, in older adults, the top number is often the bigger issue because it reflects the pressure burden on the arteries, heart, and brain. Here is where the empathy part comes in, because I know this is not just about numbers on a screen. Some of you are waking up, taking your pills exactly as prescribed, and still wondering why you feel foggy or tired. Some of you are getting a reading that looks high in the clinic and panicking all day. Some of you feel lightheaded when you stand up. Some of you are worried because your parent keeps saying, "I'm fine," even though their readings are all over the place. And some of you have no symptoms at all, which is exactly what makes high blood pressure tricky. It is often called a silent problem because damage can build quietly over time. If that sounds like you, tell me in the comments where you're watching from and what your biggest struggle is right now. Is it high morning readings, dizziness when standing, medication side effects, fear of stroke, or just confusion about what number to trust? I always like seeing what country you're in too, because blood pressure advice can sound different depending on where you live, even when the science underneath it is similar. So what is the real answer? The real answer is this: there is no single perfect blood pressure that fits every older adult, but there is still a strong evidence-based framework. For many older adults who are living independently, walking, functioning well, and tolerating treatment, aiming for a systolic pressure under 130 and a diastolic under 80 is supported by modern evidence and guideline-based practice. But that does not mean every 75-year-old, 85-year-old, or frail older adult should aggressively push for the same number at any cost. Symptoms: standing blood pressure, kidney function, medication burden, frailty, and quality of life all matter. Let me make that even clearer. Blood pressure categories themselves do not suddenly change because of age. In adults, normal is still below 120/80. Elevated is still 120 to 129, with the bottom number below 80. Stage 1 hypertension still starts at 130 to 139 or 80 to 89. Stage 2 is 140 or higher or 90 or higher. So if someone tells you that 150/90 is automatically normal for your age, that is not the full truth. Higher numbers may be common with age, but common does not always mean healthy. The question is whether reducing that pressure will help more than it harms in your specific body. Here is the step-by-step framework I use to explain this clearly. Step 1 is to stop asking, what is the perfect number for all seniors? And start asking, what is the safest, effective range for me or my loved one? That one mental shift changes everything. The benefit of this step is that it lowers confusion immediately. Instead of treating blood pressure like a school exam where everyone needs the exact same score, you start treating it like personalized medicine. The science behind that is simple. Large studies in selected older adults have shown benefits from lower systolic blood pressure targets, including fewer cardiovascular events. But those studies do not mean we should ignore real-world issues like dizziness, dehydration, falls, or a person taking 4 or 5 medications. Real-world care is not just about what lowered a number in a trial. It is also about whether the person can tolerate the plan safely. In the real world, this means asking a few grounded questions. Is the person active and independent? Are they having symptoms when they stand? Have they had recent falls? Are they taking a water pill, multiple blood pressure drugs, or medicines that can make them lightheaded? Do they have kidney disease, diabetes, or memory problems? The more yes answers there are, the more carefully the target should be personalized. Step 2 is to understand that for many healthy older adults, lower is helpful, but lower is not always better. This is where a lot of internet advice goes wrong. Some videos suggest that once you pass a certain age, you should stop worrying about getting under 130. Others imply that everyone should push as low as possible. Neither extreme is wise. The benefit of this step is protection. When blood pressure is controlled well, it helps reduce the long-term risk of stroke, heart attack, heart failure, kidney damage, and possibly vascular cognitive decline. That is why blood pressure matters so much. This is not cosmetic. It is protective medicine. The science in plain English is that lower pressure reduces strain on the vessels, but only if the body still gets enough blood flow where it needs it. If blood pressure is pushed down too aggressively in a person who is frail or prone to standing drops, the brain may briefly get less blood when that person stands, and that can contribute to dizziness or falls. So the goal is controlled pressure, not punished pressure. In real life, this means many healthy older adults can discuss a target somewhere below 130 systolic if treatment is well tolerated. But if a person is feeling weak, washed out, wobbly, confused, or is having repeated low readings at home, the conversation changes. At that point, the number on the machine is not the whole story. The person in the chair is the story. Step 3 is to pay close attention to symptoms and to standing blood pressure, not just seated blood pressure. This one is huge, especially in older adults. The benefit here is fall prevention and better quality of life. The science is straightforward. When you stand, gravity pulls blood downward. A healthy body adjusts quickly. But with aging, dehydration, certain medications, nerve problems, or stiffer blood vessels, that adjustment may be slower or weaker. If blood pressure drops too much on standing, a person may feel dizzy, blurry, weak, shaky, or mentally foggy. Some people do not even say, "I'm dizzy." They say, "I feel off. I need a moment, or I grab the counter when I stand. Here is the practical application. If you or your loved one feels lightheaded when getting out of bed, standing from a chair, or walking to the bathroom at night, do not brush it off as just getting older. Bring it up with your doctor. Ask whether seated and standing blood pressure should be checked. This is especially important after a medication change. And remember, symptoms like fatigue or dizziness are not always caused by blood pressure. They can also come from dehydration, anemia, inner ear problems, heart rhythm issues, or other conditions. That is exactly why self-diagnosing can be risky. Step 4 is to trust home blood pressure trends more than one dramatic reading. The benefit here is accuracy. A lot of people get frightened by one high clinic reading or falsely reassured by one good reading taken under ideal conditions. Neither gives the full picture. The science shows that many things can distort a reading. Stress can push it up, caffeine can push it up, smoking, alcohol, exercise, talking during the measurement, crossing your legs, a full bladder, or letting the arm hang too low can all interfere. Even white coat. Stress in a clinic can raise the number. That is why regular home monitoring, combined with medical guidance, is so useful. So here's the real-world method. Measure at the same time each day when possible. Avoid eating, drinking, smoking, alcohol, caffeine, or exercise for about 30 minutes beforehand. Empty your bladder. Sit quietly with your back supported for at least 5 minutes. Keep both feet flat on the floor. Rest your arm at chest height. Put the cuff on bare skin, not over clothing. And do not talk while measuring. Take at least 2 readings, 1 to 2 minutes apart, and write them down. That simple routine can turn random numbers into useful medical information. Step 5 is to support blood pressure with habits that help the body respond better while keeping your expectations realistic. This is where many viewers hope I will reveal one miracle food or one special supplement. I'm not going to do that because that would not be honest. There is no herb, tea, powder, or single vitamin that safely replaces a full blood pressure plan for most older adults. The benefit of healthy habits is that they support the whole system. Better sleep, lower sodium intake, regular movement, weight management when needed, stress reduction, and limiting alcohol can all help blood pressure move in the right direction. They may also make medications work better or reduce how much medication is needed over time. But that decision must be made with your clinician. The science is that blood pressure is affected by fluid balance, vessel tone, nervous system activity, body weight, insulin resistance, and sleep quality. That is why habits matter. Not because they cure hypertension overnight, but because they change the pressure environment inside the body in a meaningful way. In real life, that means building a boring, repeatable routine. Walk most days if you are able. Do some strength work appropriate for your level. Cut back on heavily salted packaged foods, canned soups, processed meats, and fast food. Pay attention to sleep apnea if you snore loudly or feel exhausted all day. And if you are using supplements marketed for circulation or blood pressure support, let your doctor or pharmacist know, because some supplements can interact with medications or affect the kidneys. Now, I want to say something protective, because this is the section too many videos skip. Not everyone should try to push blood pressure lower aggressively. If you are older and frail, if you have frequent dizziness, fainting, repeated falls, severe dehydration, advanced illness, significant kidney problems, or you are taking multiple medications that affect blood pressure, you need a personalized plan. The same is true if your bottom number is running very low, especially if you feel unwell. And if you have Parkinson's disease, diabetes-related nerve problems, or known orthostatic hypotension, standing blood pressure becomes even more important. Please hear me on this. Do not chase a trendy target because someone online made it sound universal. A number that looks beautiful on paper can still be wrong for a specific person if it comes with weakness, confusion, near falls, or poor day-to-day function. Safety is not fear. Safety is wisdom. So what does practical implementation look like? Let me give you a realistic plan. For the next 7 days, if your doctor has said home monitoring is appropriate, take your blood pressure at the same times each day, ideally morning and evening. Take 2 readings each time and record both. Also, write down how you felt: calm, rushed, dizzy, tired, headachy, or normal. If you tend to get symptoms when you stand, make a note of that to discuss with your clinician rather than trying to redesign your own medication plan at home. Then look for patterns, not drama. Are your readings consistently over 140 systolic? Are they mostly in the 130s? Are they lower at home than in the office? Do you feel worse after medication? Do you feel lightheaded only in the morning? Do you notice lower readings after hot showers, missed meals, alcohol, or poor hydration? Patterns help doctors make safer decisions than isolated numbers do. When you go to your appointment, do not just say, "My pressure is bad." Bring the log. Say, "Here are my home readings. Here is when I feel dizzy. Here is when I feel okay. Here are my morning numbers and evening numbers." That gives your clinician something useful to work with. It also changes the conversation from guessing to problem solving. A lot of viewers ask me, how long does it take to see improvement? That depends on what is being changed. Some medication adjustments work within days. Habit changes often take a few weeks to show a consistent shift. Better sleep, less sodium, regular walking, and weight loss can improve readings over time, but not overnight. What I want you to avoid is the all-or-nothing mindset. Blood pressure care is not ruined because you had one bad day, one stressful appointment, or one salty restaurant meal. Consistency matters more than perfection. And I also want to address a fear that many older adults carry quietly. Some people think, if my doctor lowers my blood pressure target, that means I'm getting sicker. Not necessarily. Often it means the goal is prevention. It means we are trying to protect the brain, heart, kidneys, and blood vessels before damage accumulates. On the other hand, if your clinician relaxes the target because you are frail or symptomatic, that does not mean anyone is giving up on you either. It means the plan is being adjusted to fit your body and your priorities. That is good medicine. So let me wrap this up with the exact truth in one sentence. The best blood pressure for older adults is not one magic number for everyone. For many healthy, independent older adults, aiming for under 130/80 is supported if it is tolerated well. But for adults with frailty, standing dizziness, falls, heavy medication burden, or complex illness, the safest target may need to be individualized with a clinician who looks at the whole person, not just the monitor. If you remember nothing else from today, remember these 3 ideas. High blood pressure still matters in older age. Lower is helpful only when it is safe and tolerated. And home trends plus symptoms tell a better story than a single number in isolation. I'm Dr. Alina Serratia, and I hope this helped you feel calmer, clearer, and more empowered. You do have influence over this, not through miracle cures, but through better understanding, better monitoring, better questions, and better partnership with your healthcare team. If this video gave you clarity, like it so the algorithm can spread a science-backed health message to more families. Subscribe for more evidence-based wellness, and if you want, leave me a comment with your country and the blood pressure question you want me to cover next.